Hi, this is Dr. Rob Dowse from Premier Pediatrics, and now I want to talk a little bit about the flu. When we talk about the flu, a lot of parents will come into the office with their kids coughing and congestion saying, oh, we had the flu last week, everybody had it, and chances are that may or may not be true because there's lots of viruses, upper respiratory infections that kind of mimic the flu. So I want to talk a little bit about the specific influenza virus, whether it be A, B, there's various types of influenza out there, but they all kind of have the same presentation. Most kids and adults will get hit very rapidly by the flu with a high fever. Many times it's up in the 104 and 105 range. They have this really dramatic cough and just deep burning bronchitis right through here as they cough. You can just hear it and they can feel it and they'll complain about that aching. And then the virus will take off into various parts of the body, including the muscles and the joints, and so they'll have body aches and they'll have joints that are really stiff and sore. But the most of the flu is going to be basically just the dramatic cough and the dramatic fevers and the achiness that they have. So what do we do for this kind of a flu? Number one, we should try to get the flu shot every year. We hear lots of different opinions about how good is the flu shot. And my personal opinion and my experience over 21 years is that the flu shot really does work. Now, some years the flu shot doesn't work as well as others because they have to literally guess which flu is going to hit the United States every year. And sometimes they nail it and they get it perfectly right on and it really works well. And other times they don't hit it at all. But either way, getting the flu shot does have cross-reactivity. And so even if they don't hit it perfectly, there is some cross-protection into the other types of flus that are going to be hit. So it's better to get the flu vaccine than not to, in my opinion. Treating the flu is really different. It depends on the age of the child and the age of the adult. But I would say that if we have a flu that is definitely looking that way, and we've seen that child within 24 to 48 hours, then it's probably worth starting Tamiflu or one of the various anti-flu medications that are out there. Because that will shorten the duration of the flu from perhaps a 10-day flu down to maybe a 6 to 7-day flu. So it can shorten the amount of days they're out of school, parents are off work, and that can make a difference. But really, for the most part, it's just going to be the basic tried and true medications of Tylenol, ibuprofen to help with the body aches and the fever. You can do any kind of rub on the chest like a vapor rub, mentholatum rub, those help quite a bit. And you can also do a cool mist humidifier at the bedside. Now remember that cool mist humidifiers sometimes will make the cough worse. So if the child has a cool mist humidifier running all night and starts coughing worse, perhaps you need to turn it off and just help the child work through the congestion that's occurring with that. That's really about all you can do for the flu. There's not a whole lot of medication that's geared towards it, although there are a lot of over-the-counter medications that state that they are good for the flu, and you can surely try those, but don't expect a lot of help. Basically, it's going to be just the tried and true medications. Hopefully that helps, okay? Thanks.